Did you know you can make six figures in the US dollar currency as a Master of Public Health degree holder? First of all, what is public health? Public health deals with a proactive approach to preventing, promoting, or improving the health of communities instead of individuals. For me, I never knew about public health until my fifth level in veterinary school when I started taking classes in veterinary public health. And that was when I first got my exposure into the field of public health. Public health is a very interesting field, and it's something that we all do every day. Every time we wash our hands after leaving the toilet, it's a public health initiative. Every time you cover your sneeze, you cover your cough, it's a public health initiative. Every time you cook your meals, you cook your meat thoroughly, you wash your fruits and your vegetables, these are all public health initiatives. Beyond these public health initiatives that we all do individually, we have a lot of public health degree holders holding different job positions, holding different job titles. I would take myself for an example. I just graduated with my Master of Public Health last year, and I specialized in environmental health, occupational health, and safety. Currently, I'm working in the field of health and safety in the workplace. But then there are other job positions that you can get into with a degree in public health, from healthcare administrator to healthcare manager to program manager, community health director, to public health data analyst, health informatics specialist, emergency management and preparedness specialist or manager, infectious disease specialist, clinical research specialist, project manager, epidemiologist, biostatistician, safety data specialist, industrial hygienist, waste management specialist or coordinator, health services manager or health services administrator, even public health attorney if you decide to go a step further into law school and get your law degree. People say public health is too saturated. I don't want to go into public health. Why? Public health is a specialty, is a field that can never be replaced by even AI, because our environment is continuously changing, continuously having emerging diseases, different kinds of injuries, and we need professionals who will be able to be on standby to help resolve these issues. Never be discouraged when you hear people say, oh, public health is too saturated, you can never make it in public health. A lot of people are going into public health. There are a lot of different fields, there are a lot of different areas to explore in the public health skills and knowledge you get after obtaining your degree in a master in public health builds you up to this level that you're very flexible, very adaptable. Anyone can get into public health. There are no restrictions, no limitations to successfully applying for a Master of Public Health degree and getting into the program. As long as you have the drive, the passion to improve the health of communities, people you're working with, and as well as the drive and the desire to learn, the sky is your limits. However, coming from a personal side, I'm a Nigerian who moved to the United States. Moving to the United States, you have to be very smart. Your choice specialization in the area of public health. Not all the areas in public health can get you what you want on the financial side if you're looking for financial liberation, financial success, or to make a whole lot of money. That's a fact we have to address. You're trying to specialize in one of the concentrations, please look for the STEM areas of public health. There are some areas that are not STEM. International students, you barely have 1 to 3 working years after your program to be able to get a job and stay in the United States. When you're going for specialties or concentrations in public health programs, please choose wisely. STEM areas will be more likely the research area, environmental health areas, the informatics, the data, the biostatistics, whereas the non-STEM areas will be the ones dealing with community health. Choose wisely. Another thing to note in those specialty STEM areas for public health, like health informatics, data analyst, biostatistician, you might require prior college level credits in advanced mathematics or statistics before you can get into this program. It's not something you cannot do. You have the drive, you have the passion. If you're ready to put the work in, you can get those credits, get started with your MPH program. Is experience, which you can get through volunteering, job shadowing, or even transferable skills and knowledge from a prior job experience. Importantly, do not forget about soft skills, even if you're lacking in the hard skills. Soft skills like effective communication, interpersonal skills, as well as problem solving skills and critical thinking are very important in public health to navigate and address the complexities that have to deal with the different groups you're working with, that to solve public health problems that are continuously emerging. Keep that in mind. As much as you want to get the hard skills, soft skills are very important. How can you get your foot in the door? Say you're an entry level, just like me, who, just this is my first time in public health field. I've not had any prior experience. Volunteer, volunteer, volunteer. Joining professional organizations helped me a lot, exposed me to what the outside world will be beyond school, beyond my MPH degree, where I would meet professionals that I can talk to that are on the same career path that I am. Which industries can you work in? There are so many industries that hire public health professionals, from government agencies, the CDC or the National Institute of Health, or state and local health departments, to private organizations, for profit organizations like the oil and gas industry, even the tech industry. Non-profit organizations hire public health professionals as well, even hospitals, pharmaceutical companies, utility companies, as well as health insurance companies. Health insurance is a big in the United States. For these different job positions and job titles I have just listed, not all of them will get you to $6 figure on an entry level. As you continue to build experience, as you continue to progress in your career, you will be able to reach that $6 there are figure. Some of these job positions here that would actually get you an entry level for a $6 figure. I'm talking those who are going to be into analytics, health informatics, biostatisticians, public health attorney, health and safety. Health and safety is an area you do not want to look down on. Everyone wants to go into tech. Well, I tell you for sure, public health is a sector that would keep attracting more people, needs a lot of professionals so that we can preserve our world. And you should do your research very well. Ask for guidance. That's why you have to network, network, network. Speak to a lot of people who are in this field. Go to LinkedIn. Look for people who are already in those job positions that you are looking forward to be in. Reach out to them and ask them, how did they get there? What did you do to get there? So let me know in the comment section. If you're a public health professional, if you're looking forward to applying for a public health degree, if you have questions, just let me know in the comment section and I'll be sure to be looking out for them. Until next time, bye.